Welcome to the Augmenting Clinical Diabetes Support with Community-Based Self-Management Education conference call. My name is James. I'll be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. During the Q&A session, if you have a question, please press star 1 on your phone. I'd now like to turn the call over to Mary Funseth. Mary, you may begin.
Thank you very much. Welcome, everyone. I hope you all have your milk and bread ready for the potential storm that may be on the way for some of you. Here at Metastar, we are hosting the Wisconsin Institute for Healthy Aging, who are providing us with our information today. So, first of all, I must read to you a disclosure because Metastar is providing continuing education credits today for this presentation. So we are going to need to inform you that no commercial support has been received for this learning activity. The speakers and planners have no conflicts of interest. For CE credits or a certificate attendance, you must attend the entire session and complete an online evaluation. To let you know, once you close out of the event, if you attended the entire event, you will then receive the survey. It will pop up for you almost immediately, so just give it a moment. So we encourage everyone to complete the evaluation to provide us with feedback on the session as we move forward. Credits available today are for physician CME, nursing contact hours, social work, dietitian credits, and National Certification Board for Diabetes Educators credits for Certified Diabetes Educator. So today, as we move through our presentation, you will be learning about the value of augmenting clinical diabetes support within a community-based self-management education. This is different from the billable education that you're providing in your clinics. Today, we gathered everyone to this particular webinar event in sort of a different way than we usually do. While folks on the phone today most likely will be mostly providers, of course it's okay and great that others have joined us, but we did this so that you could really be listening with your peers and perhaps feed off of some of those questions that others will have. We really want you to ask questions today, so this will help with your learning. So please think about it throughout the event. We also have the objective today that we want to make sure that you can recall the fact that there is this wonderful evidence-based self-management interventions out there for your patients. We are seeing plenty of referrals, but we think that it is still yet underutilized, and we would really love to see your patients come to these programs that Wisconsin Institute for Healthy Aging will be sharing with you today. They have created this wonderful new tool for referral, and it is to get you into those evidence-based programs, which they will describe to you. So it's very important to us here at Metastar to work directly with Wisconsin Institute for Healthy Aging. They've been providing these wonderful resources. We are especially connected to them through their diabetes program, which we heavily encourage you folks on the phone to refer your patients into. We're going to tell you this multiple times throughout the day, but it's the reason why we repeat ourselves is because it's very important for you to know that what they do in these particular self-management education programs, they are not competing with the billable programs that you are hosting in your organizations. And the reason is that the patient goes into these classes and they learn amongst their peers about very same details that you're trying to share with them right there in the clinic. But sometimes they need to be told more than once. Sometimes they need to hear it from others. And it's also the fact that this is happening over a longer period of time than the shorter amount of minutes that you're able to provide them in the clinic. So they are going to be directed back towards you, and Jill and Chris will be sharing that today with you. So at this time, it is my pleasure to start us off by turning this event over to Chris Krasnowski. She will introduce herself. And Chris, I am sending you the ball.
Mary. And thanks to everybody on the line for joining us today as we talk about how evidence-based community interventions can support the clinical work that you're doing in diabetes management. As Mary said, and I'll reiterate, what we hope you'll take away from this hour is a general awareness of the community-based interventions in diabetes prevention and self-management that are available to you, and the value of the fact that these are evidence-based programs, researched and proven to work and support the clinical work that you do. We want to make sure you're well aware and have an introduction to access the portal that we've recently created for making referrals to a self-management program, these in particular, but others as well. And ultimately, we hope you walk away from this session with the belief that community-based supports can really encourage behavior change in your patients, which I know can be, in some cases, some of the most challenging situations that you have to deal with is in getting compliance with the care plans that you have so that your patients have better outcomes. So just piggybacking on what Mary said, that's what we're hoping for you today. So this slide may be familiar to some of you, or you may have seen it in a little bit different format. We kind of like the pie chart version of this. This is our determinants of health slide, which comes to us from the University of Wisconsin Population Health Institute as part of their county health rankings model. And what this really shows to us is all of the different factors that play a role in good health outcomes for individuals. One of the things I always feel like I need to note here now about this is because lots of times we'll be talking to consumers and they'll see this slide and they'll say, yeah, but what about genetics? What about my genetics? Isn't that a major factor in my health outcomes? And yes, that's true. What this really does show is the modifiable determinants of health, those things that we can actually do something about. And so just to add that little disclaimer to this so that it's really clear. As you can see from the orange slice of pie there, they've determined that about 20% of an individual's health outcomes is based on the clinical care and access and quality to the clinical care that they receive. If you look to the left side of the chart, a full 40% plus 10, so 50%, is really related to the social and economic factors and the physical environment that an individual lives in. So whether or not they have housing and transportation, clean water, that's their physical environment. Then other social and economic factors such as education, income stability, and other things that are some things, oftentimes things that can be changed, but not without supports like respite programs and employment training and the other things you see listed there. A full 30% is really related to their own health behaviors. And I'm sure this won't be a surprise to anybody, but this is the area where we feel we can have the greatest impact in terms of getting folks to comply more with what they know to be better health outcomes, but because it's such a challenge to change health behaviors, we see the programs that we offer at the Wisconsin Institute for Healthy Aging as being highly focused on behavior change and supporting people's ability to make those changes. My mom, I like to mention this because she used to say this all the time. She passed away in 2014, but she was a nurse and she would talk about this a lot, how challenging it can be to get folks who didn't necessarily have the knowledge or skills to change the behavior that was contributing factor to their poor health. So these chronic disease self-management programs are designed to combat that problem by promoting really, truly meaningful behavior change. A little bit about WIHA, the Wisconsin Institute for Healthy Aging. We're a nonprofit clearinghouse of evidence-based prevention programs in Wisconsin. As our name says, Wisconsin Institute for Healthy Aging, we really were launched in about 2010, 2011 really as a conduit through which the Wisconsin Aging Network, the aging offices and aging and disability resource centers in the state and counties and tribes were offering these health promotion programs to older adults in their communities. We have since expanded, the Aging Network continues to be a major program provider of these programs, but we've expanded the types of program providers that we're working with today, and they include healthcare organizations, YMCA's, fitness centers, senior centers, you name it, organizations that have an interest in the health of their community and want to be able to deploy some of these programs to meet those needs. Again, our mission is to bring evidence-based programs to communities throughout the state to encourage healthy living and healthy aging. We, again, have recognized that, again, it's not just about aging, that some of the chronic disease self-management programs in particular are really for adults, not just older adults. So we really are looking to developing new partnerships to be able to bring these programs to people of all ages who are experiencing chronic conditions. Want to briefly also just give you a better sense of the Institute and what we do. We're pretty unique in the state and in the nation and maybe the world in how we operate. We have a research arm called the Community Academic Aging Research Network that's under the auspices of the University of Wisconsin. And the idea there is to work closely with communities around Wisconsin who identify problems and challenges that they're seeing regularly with older adults specifically, and then matching them with researchers at the University of Wisconsin to develop interventions that we can then research, develop, package, create programs that will then be evidence-based or become evidence-based over time and through randomized control trial. And they move then over to practice once they've been researched and proven to work. And we at the Institute begin to create implementation, packaging, and dissemination so that we can finally deliver it to people and communities around the state. And this year particularly, we have a lot going on with some of these new programs rolling out, and we'll touch on those in a little bit. But to date, at the Institute, we've served over 36,000 people in the state of Wisconsin with one of the evidence-based health promotion programs. Again, for WIHA to be a program that WIHA administers, we require that it be a high-level evidence-based program. And while other programs may really be good and supported programs, our niche is really in evidence-based health promotion. Just touching on this quickly, just so you can get a general sense of the partnerships that we have developed and work with to be able to deliver programs. We work with academic researchers, as I mentioned, through the Community Academic Aging Research Network. We work with state public health and aging policy agencies through the Division of Public Health, Bureau of Aging and Disability Resources, on the Bureau of Community Health Promotion. All of our program provider partners come in some of the other two categories, the community organizations, such as the Aging Network, aging offices and aging and disability resource centers in counties and tribes, senior service providers, housing facilities, fitness centers, YMCAs, and really the sky's the limit in terms of who we're finding to be really terrific program partners to provide programs in the community. We also work closely with healthcare and related organizations, both payers and providers in hospitals and health systems and even in health insurers. So those are some of the partnerships we've developed to be able to do the work that we're trying to do in disseminating evidence-based programs. I'm just going to quickly run through, because I know you're wanting to get to the diabetes self-management programs that we offer, but just to give you a general sense of what we do, Healthy Living with Diabetes, both in English and Spanish. That program Jill will be talking to you about in a second. The diabetes prevention program that we don't administer but support through a partnership with the Division of Public Health. Living Well with Chronic Conditions, we'll also mention that program as the backbone program to many of the chronic disease self-management programs we offer, and that is also in English and Spanish. Healthy Living with Chronic Pain, another adaptation for folks who are dealing with, obviously, chronic pain and pain-related issues. Better Choices, Better Health, which is an online self-management program, group-based self-management program for people with chronic conditions. Walk with Ease through the Arthritis Foundation. It's a physical activity walking program started for people with arthritis, but also for people who just want to get moving. Stepping on Falls Prevention Program, probably the program that we do the most of, research to improve and to decrease falls by 31% in participants. And Powerful Tools for Caregivers, a caregiver support program designed to support the caregiver themselves and help them maintain their role as a caregiver. And lastly, it says coming soon, but truthfully they're here already since we developed this. PALS, Physical Activity for Lifelong Success, a program designed to get beginners, older adults who are beginners to physical activity to move more and begin exercise. And lastly, Mind Over Matter, Healthy Bowels, Healthy Bladder, a 3-session incontinence program for older adult women. And with that, I'm going to turn it back to Jill.
Good morning, everybody. My name is Jill Rankin, and I am the Director of Program Provider Partnerships at the Wisconsin Institute for Healthy Aging. Just a little bit of background to give you a background of where I'm coming from here is my role with WIHA is to work with all the organizations throughout Wisconsin that are providing these programs in their communities. We've got just about 200 organizations, and Chris listed the different types of those. So really, we really work to support all of our organizations and our program leaders and facilitators of these programs through a variety of different methods that I'll get into towards the end of the presentation. But that's my role. And then my background is public health, community health education. I've been working with these programs for over 10 years now. It's been really exciting to see the growth throughout Wisconsin for sure. And then also just note, I'm also a trainer, a master trainer, so I train our leaders and facilitators throughout the state on both the Living Well program as well as the Healthy Living with Diabetes program. So I've been able to have some really good, solid experience looking at how these programs run in a community as well as the statewide overview. So just a little bit of background. As far as all of these programs go, the base of them is really designed to enhance and complement the clinical-based education and treatment plans that you all are working with. And as Mary said, and Chris also mentioned, that these programs are all theory-based. They're all evidence-based. So they've gone through clinical trials to determine the health effects and the health outcomes of them. And really with the backbone of increasing what we call self-efficacy, which is increasing an individual's confidence that they can carry out health behaviors in their everyday life. We know that they work with their healthcare providers and they go to an appointment, but then taking that information into their everyday life once they go home and dealing with the daily stresses that they deal with and figuring out eating and exercise and all that good stuff. The theory behind these programs is that we're increasing their confidence to be able to take that health information and then apply it to their life. So all of them have that backbone and that theory behind it. The program content gives them a basic health information. We provide them with what we call a toolbox to better manage their health that people can individually pick from. So we'll provide things, and you'll see in the following slides things like healthy eating and exercise and stress management and all that good stuff. Monitoring their blood glucose and all those things. But they're really designed to give them a toolbox of different things that they can use to put together an individualized plan for them and how to manage their diabetes and chronic conditions. And all of the information on these programs is the researched and proven, the credible resources. We have all of the diabetes content through the American Diabetes Association, and all in line with all of those accreditation processes. So the programs also really serve to foster that linkage between the community-based education and then the clinical. So for example, in our Health of Living with Diabetes program, you'll see it's a 6-week program, but on that 7th session, we have a certified diabetes educator, whoever is at the local contact in that community from a health system, coming in and talking a little bit more about more personalized services. And the goal really is for them to get activated through these programs and then seek out those clinical services that you all are providing, and as well as the direction from their primary care providers and their other healthcare team members. Any personal medical questions that come up in the classes, we are referring them to their physicians or their diabetes educators. If any of the content conflicts with those instructions that they might receive elsewhere, we definitely always advise them at every session to follow their physician's orders and discuss those discrepancies with their healthcare team. Also, just want to note these programs are scripted, so the content of them, the health information that is given, while it is researched and proven and accurate and credible, is also it's the same wherever anyone takes the workshop. So whether it's happening in a small rural Wisconsin community or a larger community, it's the same, as well as people that go to a different state. These programs are packaged and available throughout the nation as well as throughout the world, and they're available in a variety of different languages. So just quick overview, chronic conditions-wise, why are we talking about it? 80% of adults have at least one chronic condition and 50% have two. So we know it's a significant issue. We know that it's responsible for over 2/3 of our United States deaths annually, and it accounts for over 80% of our healthcare costs, which is very significant, as we all know. So the first program I'm going to give you a brief overview on is the Living Well with Chronic Conditions program. We also have it available in Spanish, which is Tomando Control de su Salud. That is available here in Wisconsin. And this program is the backbone program, as Chris mentioned, to the Healthy Living with Diabetes program as well. So I'm going to give you a brief overview, and this one really was the first program that was designed. And what we found, and also nationwide, was that the majority of participants attending Living Well had diabetes. So we strongly recommend that this program is definitely applicable to people with diabetes, but it's very broad and it covers all chronic conditions. So for those who have diabetes as well as chronic heart disease or depression or anxiety, it really deals with the whole spectrum of chronic conditions. So this program is 6 weeks. The group meets once a week for 2.5 hours. It's 2.5 hours. Sometimes it goes down to 2 hours, but designed for 2.5 hours. It's delivered in a group workshop setting in the community. The ideal class size is 12 to 15. It's that magic spot. We've got a minimum of requirement of 8 participants, and then a maximum of 18. The program is facilitated by 2 trained program leaders. So our leaders go through a 4-day leader training where we teach them the solid facilitation skills, as well as the content of the program. And as I mentioned, the program content itself is scripted, so it's heavy training on group facilitation skills. And then it's available in English and Spanish. So the program was developed by Kate Lorig at Stanford University, along with Kaiser Permanente. It's evidence-based, as I mentioned. It's gone through several clinical trials. And it's evidence-based for people who have one or more chronic conditions, diabetes, of course, being a very common one there. We know that people who take the program have a 28% reduction in average emergency department visit, and also a 22% reduction in average hospitalizations, and that is 6 months post the intervention. So we know that these are lasting effects. We also have data a year out as well, and all of them are consistent with these percentages. So the total average healthcare costs that are averted by somebody taking this program, this is national data that also matches with our Wisconsin-specific data, and that is $714 per participant. Currently, we have about 250 leaders here in Wisconsin that are facilitating the program, and over 11,000 participants here in Wisconsin over the past 10+ years. So just briefly, the topics that are covered, I'm going to go more in depth once I talk about the diabetes-specific program, but just so you can see the Living Well program, the topics that are covered are general wellness type things, sleep, mind-body connection, problem-solving, action plans, which I'll get into later. We talk about emotions and making decisions, pain and fatigue, exercise, healthy eating, positive thinking, medication, and also, as you can see on that last one, is working with healthcare professionals and organizations as well as weight management. So you can see it's overall really good for anybody. I always say this program, it helped me when I was in my 20s, even when I first started it. So helped me through pregnancies and all that good stuff. So I really, it's a great program, great base program for anyone dealing with any sort of diabetes as well as just general wellness. Then we have the diabetes, like I said, the diabetes-specific program that is really born from the Living Well program, and that is, it has the same base curriculum as Living Well, but it is definitely more diabetes-specific content to it, and we really dive deep into those diabetes-specific issues. So the research is also there, which I'll talk about in a minute, but this is all not new information to you all. I think you all work within this realm, but we know that 1 in 3 Americans do have prediabetes, and as you can see, a significant amount of Wisconsin adults, have diabetes as well as prediabetes. We know that the average medical cost for a person with diabetes is about $13,700 per year, and we know that about $7,900 or 57% of that is attributed exactly to diabetes itself. So a high need for these diabetes education programs. So like Living Well, this one meets also for 6 weeks, once a week, that 2.5 hour time frame. It's delivered same in that group workshop setting. It's also trained by 2 program leaders that serve more as facilitators. And just want to note that these program leaders can be professionals as well as volunteers. Very often we will have people go through the program and see how it impacted their life, and then they go ahead and they take the 4-day leader training and become leaders facilitators themselves. And the research actually, this was specifically researched, and what we found was that people who, if the class was facilitated by professionals, for example, people may have learned a little bit more, but when it was taught by peers, given the script that they have in that content, that they actually started to do more. That behavior change was significantly increased by people who were leading the class with their personal experience. So, for example, when I lead the Healthy Living with Diabetes program, I do not lead it as I'm Jill, a health educator. I lead it as I'm Jill and I had gestational diabetes. And that is the perspective that I use when I am facilitating the program. So that is unique to these programs and very special. And then again, it's available in both English and Spanish. So this program again was researched and proven. It was based from the Living Well one, and then we had gone through significant clinical trials. And the clinical trials were with people with type 2 diabetes, so we know that this program is evidence-based for people with type 2. It is applicable for anyone with any type of diabetes. Like I said, it was very helpful for me when I was going through gestational diabetes and prediabetes and all in type 1 as well. We know that with the research with the type 2 diabetes participants that there was a 53% reduction in average emergency department visits, and that is within the first 6 months following the intervention. We've seen improvements in A1Cs, the total average healthcare costs that are averted, and this is also national data, as well as we have Wisconsin-specific data that very closely matches this, that we're happy to give you, is $816 per participant that goes through the workshop. So as you can see, a significant amount of health savings just in this 6 weeks. Currently, we've got about 240 program leaders, and approximately about 5,000 participants here in Wisconsin have gone through this program. So the topics covered, I'm going to talk a little bit about, you can see the content, I won't read through these, but as you can see, they're more diabetes specific. So we talk about healthy eating, we go into depth about meal planning, we give them some tools to do that and have activities in doing that. We talk about monitoring glucose, weight management, stress and depression, medications, and also that important topic of working with their healthcare professionals and organizations. But I really want to touch on the first point here, and that is the sharing and the problem solving, as well as developing action plans So the reason why these programs do increase that self-efficacy is because not only because of that they are peer-led, so peers are learning from each other with the scripted material, but the facilitators in those 4 days of leader training really learn how to facilitate group dynamics and learn how to facilitate the process of these action plans. So the action plans happen at every single session, and what happens is participants will make detailed short-term goals. So for example, and I'll give you an example here in a second, but the action plans are for 1 week. So they make a short-term goal, and then the week after, when they come back for the next session, they report on how they did with those goals, with their action plans. And we structure them so that they are doable. There's something that the participant wants to do. So here's my example here, and I like to give this one is I had a participant that said, week number 1, she said, I want to clean out my bathroom drawer. And I'm going to do that on Tuesday and Wednesday, for example, and I'm going to spend an hour on it. So what happens is then that participant came back on week number 2, and she was successful with her action plan. The group was congratulating her, great job cleaning out your bathroom drawer. And then throughout the rest of the 6 weeks, we talk about everything like weight management and monitoring their glucose and all those things. And then those action plans start to become more health related. So towards the end of the session, then she was exercising 3 times a week, taking her dog for walks, things like that. So they start to they get excited and empowered that they can actually accomplish goals. And then through the process of the facilitation, we are not telling them what to do, but they are getting empowered and hearing great ideas. So then they're incorporating those into their action plan. And then when a participant comes back the next week and they are not successful with their goal, we go through problem solving. So it's a specific strategy that we use where they are talking about what got in the way. So what was my barrier? Maybe my husband was sick, so it was hard for me to exercise last week. So we go through and we talk a little bit, what could we do to overcome that barrier? Maybe it's, find a babysitter or something like that. So the group then helps themselves or helps the other participant come up with solutions that might be able to increase their success of completing their action plan. So that's where really the theory of the program come into play. And then we also have the diabetes prevention program, and that we work with the public health department. It's a CDC-based program, and that one is it's a year-long course versus the other ones that are 6 weeks long. It consists of 16 one-hour weekly classes, and then about 6 to 8 hour sessions that are either biweekly or monthly. And these are delivered in a group setting as well, at about the same amount of participants. We like to see about 12 to 15 participants in a group for that group setting, and that is facilitated by a trained lifestyle coach, which is a little bit different than the other ones. There's only one lifestyle coach for these, as compared to the two leaders for the other programs. This one is researched and proven. We have significant amount of clinical trials that go into developing this program. And this one, like I said, was developed by the Centers for Disease Control Prevention. And this one is actually for people with pre-diabetes or those who are at risk at developing type 2 diabetes. So we know that through the research that the people who have pre-diabetes and they take part in the program reduce their risk of developing type 2 by 58%. And that number increases as they get older. So we know it's 71% decrease in risk for people who are 60 years and older. And this program is also held in over 60 locations here in Wisconsin. And Chris is going to go through how do you find the programs and how do you get connected. The topics that are covered in this program are also very similar to the Healthy Living with Diabetes program. And as you can see, physical activity, stress management, and also those goal settings and problem solving is a significant portion of this program as well. And with both of these, really, like I said, these are topics that give people the tools that they can use to come up with an individualized plan on how to manage their diabetes on their everyday level. So I'm going to go ahead and hand it back to Chris to talk a little bit more about how to access these programs.
Okay, thanks, Jill. All right. So what you're seeing here, and we're going to talk a little bit now about ways that you can refer to one of the programs we've discussed. What you're looking at is a little bit older version of a screenshot of the WIHA website. But let's take you there right now. Here we go. So this is the homepage of the Wisconsin Institute for Healthy Aging website. And you'll note here at the top that there's, in the top navigation bar, we have a link for making a referral. We also actually have a link down here as well to make a referral. So a couple of different places for you to be able to find this on our website. But we'll go ahead and click in there, and it takes you to a making a program referral landing page. From this page, we have a couple of different options. You may, one link or one form was created for individuals or consumers to be able to refer a friend or family member for one of the workshops. And the second is really for professionals, and that's what we'll talk about today, to be able to refer a member, a client, a patient. We recognize that many of the referrals that we'll be getting will be coming from healthcare professionals, but also that some may be coming from other disciplines as well. So we tried to create a tool that would work for referrals coming from any type of professional. You'll also note on this page and also in the top navigation, if you're interested in learning more about the program, we have a link to that here from the page and in the top navigation here where you can drop down and take a look at all of the programs we offer and learn more about those. So let's go into the professionals referral form. And again, as you see here, this brings you to a spot where initially you're going to come up to a referral code. That's only for folks that we have a contractual relationship with to provide specific services or to get individuals into specific workshops. So for most people, unless you're part of a contractual agreement with us, you would not necessarily be needing to do anything with that area. Moving down, we do ask you to let us know if the person that's for whom you're making this referral has consented to the release of information in the form. It's not something that we require for you to be able to submit the referral, but we do like to know whether or not that person is aware that that they've been referred to a program. So as they are being contacted, it's they have some general awareness of this, and it's not a surprise. Moving down, you'll see a space where we offer information about the person I'm referring. So we're asking for first name, last name, birth date, and if you don't have this information, we give you an out there. We recognize sometimes you won't. A phone, daytime phone, and other if possible. Daytime phone is required. Email we like to have, of course, but if we don't, that's okay, not required. An address with the city and zip, and also county. Some of the work we do in searching for workshops that or best match the needs of the person being referred really centers in on county and zip code. So once you've let us know who the individual is that you're interested in referring, you're going to come down to program selection. And again, this first box was really created for private workshops for a select group of people that are not open to the public. These are, again, for folks who have contractual agreement with us to either put on a unique workshop or exclusive workshop for them, or have members or clients or individuals who they want to be able to send to a very specific workshop. So again, for the vast majority of people who are just going through this referral process to send clients or patients in, you would not use this private workshop section, but rather scroll down to the general workshop and toggle that button on, as I am doing now. Then it gives you the option to select the programs that you're referring to. And here you're going to see a drop down of all of the programs that WIHA offers. you're going to be able to select one, and let's take since we're talking about diabetes today, let's select Healthy Living with Diabetes. From there, it's going to give you a very general overview of what the program is, less than what Jill provided, but more than zero, and who it's for. So some criteria for who the program is intended. Then we ask you to tell us which counties or tribes this individual would be willing to take the program in. So we've learned that even though someone lives in a specific county, it may be close to the line of another county. My dad's a great example. He lives in Neenah, but it's technically Winnebago County, but he really thinks he lives in Allegheny County. So you can select multiple programs or multiple counties, here, and let us know that you'd be willing to take this person will be willing to take the workshop in several different counties. And if you're unsure, again, click this box, and we will be contacting the individual directly. Lastly, we have a space here for comments. So if you there are additional details that you can fill us in that might be helpful in terms of us being able to fill the referral. It gives you the option to do that there. Then we request information about you, who you are, your agency, clinic, company, phone and email. And lastly, gives you a general sense of how this form is HIPAA compliant and the contents are protected. So all this information is kept confidential. Once we receive, you click submit referral. Once we receive that referral, we do a triage from our offices and look to identify a program provider closest to that individual, offering the program that they're interested in taking, and work together with the program provider to get the person enrolled into a program. So again, it's not I think the form itself is pretty simple, but this is really very brand new for us. We just have rolled this out in the last month and a half or so. So we're interested in your feedback. If you can think of ways that we can improve this and make it more user-friendly for those of you making referrals. We also encourage you, if it's possible, and you can consider embedding the form into an electronic medical record, and would like some assistance, we can engage our technical team vendor to help us with that, and you would, I'm sure, have to do that on your end as well. But this might be a really great way, if it's part of the EMR, to make it a little bit more obvious for you, a little bit more top of mind, or front of face, sort of, to be able to make these referrals. The other thing I want to call your attention to here, particularly because we're talking about diabetes, is we do also, in conjunction with working on a project with the Division of Public Health at the state, we do also have an option for clinical diabetes self-management education and support. And when you click that, up comes what I think many of you may be on the phone, and certainly others in your organizations may be providing. We want to provide a referral opportunity or link to the ADA, AADE accredited diabetes self-management education services and support that are happening in hospitals and clinics. So this, when somebody were to click this, we would go directly to our own Pam Geis, who has provided us with links to the state ADA, AADE programs, and work to find the most appropriate program that we would be referring back, in some cases, to you. So just wanted you to be aware of that. That's, again, this is something very new, and we haven't even had a referral come in of this type yet. But I think it may be another way for us to support diabetes self-management education by sending folks into your clinical programs that are accredited by ADA and ADADE. So just wanted you to be aware of that and see that we have that also as a potential selection. All right. So I'm going to turn this back over to Jill. We've just talked a little bit about the referrals and again, the potential for you to embed the referral portal URL into your EMR for access. I'm going to turn it to Jill to talk a little bit more about the potential for you to become a program provider or work with WIHA to provide programs to your patients.
Yeah, thanks, Chris. So as you can see, there's a variety of ways to become involved and to add this to the services that your patients have access to. One, of course, is the referrals that Chris just went over. Another option is to become a program provider or contract with WIHA to provide the programs for patients. If your organization yourself isn't providing the programs, which some of you are, then we can certainly work with WIHA to contract and make those programs available to your patients through a contractual basis. And what we do with those is we really work to provide some solid wraparound services, not only giving you access to the programs or your participants access to those, but individualized ways to make it easier for them to engage in the program. We provide, with both our program providers as well as our contracts, a heavy amount of technical assistance is available through those organizations that we're working with in either one of those realms. We do a lot of coaching as far as best practices and successes for interventions. We provide continuing education opportunities. We've got annual events where we all get together, and all the program provider organizations throughout the state are talking and networking. We do a lot of connecting in the communities. As we mentioned earlier, how these programs really serve to augment and to complement the programs that you're currently and services that you're currently doing within your hospitals and clinics and centers. So really establishing different implementation teams and connecting all the organizations within your community to make sure that there's an effective referral process, that folks are accessing all the services that are available to them, and that they're continuing to receive the services that they need in order to manage their diabetes and other conditions. So variety of different services that we offer. We also do a lot of data collection on the WIHA end for any of our program providers and our contracts, as well as additional services to ensure success, ensure streamlining of processes, documents, marketing materials, and anything that helps our program providers be more successful and make it easier on you and less time consuming. So that is our role, is to help you become more successful and to help our patients and our community members to have access to these programs. So that is, you can definitely contact us. We're available for questions here in about 30 seconds. But please do reach out if you have any questions about how to become involved. I am available. My contact information is at the bottom. Of course, there's no wrong door to contact anyone here at WIHA. Chris is available to talk more a little bit about if you have questions specifically on the referral portion of how to get involved. But please do contact us. We are here to help make connections and help us all work together. And so now we are open for questions.
Thanks, Jill. That's wonderful. Our operator will give us those instructions again.
Thank you. We begin our question and answer session. If you have a question, please press *1 on your touch-tone phone. If you wish to be removed from the question queue, press the # sign or the # key. If you're using a speakerphone, you may need to pick up the handset first before asking your question. So again, if you have a question, press *1 on your phone.
While you're thinking about those questions, I'll put this question to Chris. Chris, can you speak a little bit about the program that you also have, the online program, Better Choices, Better Health, please?
Yes. Again, a new program to us, but recognizing that for some people a workshop may not work. Although we wanted to maintain, an in-person workshop may not fit their schedule, or may be challenging for some people just in terms of their comfort level with that. So we're working with Canary Health to offer the digital Better Choices, Better Health program. It is based on living well with chronic conditions, so it is a chronic disease self-management program not specific for diabetes, but for any chronic condition. And again, it's still in a group setting. You still have a group of the same people that you go through this program online, and it has some of the same great health outcomes and impacts as the other diabetes self-management programs and chronic disease self-management programs that we offer. So we're very interested in engaging people who are interested in this program, and are really happy to talk with anybody who may want to be able to refer into Better Choices, Better Health.
Thanks, Chris. So we had any callers requested ask a question?
I'm afraid we have no questions.
Okay. It's all right. We still have a couple of moments.
This is Chris again. Just wanted to reiterate that the potential for embedding the referral form into an electronic medical record potentially, or other systems that you may have in your hospital and clinic settings that might make the idea of doing a referral a little bit simpler. We really strongly encourage that and would really like to work with providers in getting that happening in some places. So I'll throw that back out there again and encourage you to contact me or Jill or anybody at WIHA who can help get that process started for you if you're interested, to make it a little simpler process and a little bit more top of mind for you to be able to make referrals into these programs.
Thanks, Chris. We do have a question from our chat box. The question is this: do the trainers learn how to lead every program or only one program?
Great question. So they learn how to do one program. However, if someone is trained in a Living Well with Chronic Conditions, which is that backbone-based curriculum, in order to get trained in diabetes, all they would need to do is go to what we call a cross-training. So they go through the full 4 days of the Living Well program, and then they can go to a shorter version of a one-day cross-training for the diabetes program. Or someone can just get trained in the diabetes program and just attend a full 4-day training just for the diabetes-specific one. And then as far as the diabetes prevention program goes, that is a total separate training.
Thanks, Jill. We have time for another couple of questions. We do have another question come through. Follow-up question: does WIHA train the diabetes prevention program trainers?
No, we do not specifically train for that program. We do work with the trainers, so we can definitely get you in touch with those folks.
Excellent.
And I would say if you visit the WIHA website, and I would encourage you all, if you have a second, to poke around on our site. We have a section that talks specifically about leader trainings, discusses the dates and locations and how to connect with a program provider. We ask all of our leaders to be working directly under a registered program provider with WIHA. But it explains the entire process for becoming a program leader and how you can become registered to take the training.
Thank you. We have an additional question for you. What are the costs associated with these programs?
So this is Jill. As far as the cost associated, there is a leader training fee. There is no fee to become a program provider, a registered program provider, but there is a fee for each leader and facilitator to become trained. And then as far as implementation of the programs, we can certainly talk offline with you. We've got some formulas that you can help plug in your costs of staff time and things like that. Different marketing strategies that you want to use in a formula to come up with those specific costs for your specific organization. But they are very low cost as far as technology and things like that go. The materials are low cost themselves. It's just more of, I shouldn't say just, but we all know that time is the most valuable time to implement the program versus actual material costs.
And I just pipe in too, if you're wondering about the cost to participants of the program, the WIHA programs really range from zero. In some cases, the program providers don't charge anything of the participants. In other cases, I think it's been as high as maybe $35 for the full 6 or 7 weeks, 7 weeks in the case of stepping on our fall prevention program. So the WIHA administered programs, the participant costs when someone's referred are quite low. So just to let you know that.
Yep, and I think diabetes prevention programs, and of course it depends on each location, but that one's a little bit more as far as cost goes for participants.
Okay, so we have, we're coming to the close of the session. I just want to mention that when we are done with the session, as you exit the webinar, if you wait just a moment, your survey will pop up. Post the survey if you are applying for credits. It will ask you what credits you're applying for, and then the test associated with those credits will pop up. If you have any questions or concerns regarding that, feel free to contact myself, Mary Funsteth. In addition to, the great questions we've had so far today, please go ahead and directly contact either Chris or Jill. As you can see on the screen, their contact information is available. But we're also able here at Metastar to possibly field some of these questions and answer them and or connect you with Chris and Jill or anyone else over at WIHA, so feel free to contact me as well. We've really enjoyed having you all on the call with us today. We thank you very much for attending, and thank you again, Chris and Jill, for providing us with this information, and WIHA for sending you.
Thanks to Metastar for hosting.
All right. Thank you, everyone. This concludes our call.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.